is a great time to start thinking about getting your kids those necessary shots before they head back to school. Dr. Christy Peterson with the Navicent Health is here to talk about back-to-school immunizations. So, good morning to you, Doctor.
Good morning.
So, we're talking about immunizations, and now is definitely the time, as most people have stated. So, when we're talking about scheduling appointments, you want to schedule them throughout the summer, right before, they head back, right?
Well, if everybody waits till right before, it's going to be a
little bit crowded.
A little bit of crowded. So, now would be a great time for parents to think about scheduling their before school or back to school health checks for their, especially the children that are just starting school. At 4, they're typically...
so the younger ones?
Yeah.
Okay. So what kind of immunizations do the younger ones need? We're talking 4 to 6 years old here.
So typically at 4, we give the second dose of the MMR, which is measles, mumps, rubella, and a varicella vaccine along with that, which is, so sometimes it's combined into MMRV, and that is a vaccine that prevents measles, mumps, and varicella.
Now, we were talking earlier, this is something that you can actually get before 4, right? Before 4 years old.
Yeah, the vaccine is given at 1, and then a booster at about 4.
Okay. Now, what about tetanus? Let's see that we have that on the list.
Tetanus is typically given in a multi-shot or a multi-vaccine shot. Tetanus, diphtheria, and acellular pertussis are all given at the age of 4.
Try saying that 5 times fast, right?
Right.
All right, so polio.
And then polio. This is the 4th or 5th shot in a series that prevents polio.
Okay. And now, DTaP. This is something that parents...
That's the one I mentioned before, that parents have probably heard of as tetanus. But it also contains diphtheria and acellular pertussis.
Okay, now this was 4 years old. What about 5 and 6?
Well, every year it's recommended that children of all ages get the influenza vaccine.
Okay. Influenza, we're talking about the flu shot, guys,
yes.
So definitely something needed, and even our age, we need the flu shot. Okay, so why do you think some parents are reluctant to getting some of these vaccines and immunizations? Because there's been a lot of different articles out and things out right now that parents are just reluctant to get testing for their kids.
Well, first of all, vaccines hurt, and parents don't like to see their children hurt.
That's right.
And maybe they're not familiar with the diseases. We haven't seen some of these diseases in years, so we forget how bad having the disease is. And if we could see that or remember it, we would not want that for our children. And so the shot is a very momentary moment of pain that we can remind the 4-year-olds as they go to the doctor's office. Tell them they will be getting shots, but it is a short, painful, it is, yes, painful, but short and very small compared to the pain of having the disease.
And beneficial.
Yes, preventing the disease, yes.
All right. Well, thank you so much, Doctor, for telling us all about back-to-school immunizations. And for more information or some other great tips, log on to kidshealth.org. Stay with